I'm a fellowship-trained breast surgical oncologist. I'm Dr. Amani Jambakar, and someone just asked me, what is the difference between a sentinel lymph node and an axillary lymph node? Sentinel node is usually an axillary lymph node when it comes to breast cancer treatment. For other types of cancer, a sentinel node can be located in other lymph node basins in other parts of the body. But not all axillary lymph nodes are sentinel nodes. Let me explain. This picture is depicting sentinel lymph nodes. You can see that this little blue lymphatic channel here is demonstrating which two lymph nodes that this cancer would spread to first if it tried to spread outside of the breast into the lymph nodes. It is not these lymph nodes here which are physically closer to the cancer. It's the ones that the lymphatic channels would take the cancer cells to first. Axillary lymph nodes means all of these lymph nodes which are under the arm and in the armpit area. And this basin right here under the arm is where breast cancer tends to spread to first. But rarely we can see that cancers in the breast can spread to lymph nodes within the breast, which are called intramammary nodes, or even to these lymph nodes all the way on the other side of this image, which are internal mammary nodes. But the vast majority of the time, sentinel lymph nodes, or the ones that the breast cancer would spread to first, are axillary lymph nodes, or lymph nodes that are under the armpit. In the past, we used to do something called an axillary lymph node dissection, or remove all of these lymph nodes instead of just removing the 1 to 3 that the cancer would spread to first. Studies showed that removing all of these lymph nodes under the arm did not make any difference in how long patients lived after being diagnosed with breast cancer, but did greatly increase the odds of lymphedema or permanent irreversible arm swelling. So now we just remove these sentinel nodes, or the lymph nodes that we know that the cancer is going to spread to first, because we know that if cancer isn't in these lymph nodes, it's also not in these lymph nodes, which are further up the chain. And recent guidelines have shown that we don't need to remove sentinel nodes on everyone. Many ladies with estrogen and progesterone receptor positive cancers who are postmenopause or over the age of 50 may not need to even have the sentinel lymph nodes removed. That's a conversation to have with your surgical oncologist. How many lymph nodes are they planning to remove, if they're planning to remove any, and what is the data behind that decision-making process?